or 2 minutes. I'll give it like 1 minute and then we can get started. I know people are still joining us. I could add people, right? I just added people. Okay. Okay, wonderful. All right, so we'll get started. So again, welcome those of you who are just joining us. My name is Dr. Ijeoma Opara. I'm an assistant professor at the Yale School of Public Health in the Department of Social and Behavioral Sciences. My research focuses on using strength-based approaches to substance use prevention for Black girls and overall within urban communities. So focusing on youth in general, with a specific focus also on Black girls and developing race and gender specific prevention interventions. And today I have three amazing professionals who are going to be joining me, and we're all going to be having a really intense and deep conversation and productive conversation on how to use strength-based strategies and other types of prevention strategies for substance use prevention for the Black community. So I'm going to go ahead and call out our panelists, and when I call you, please just introduce yourself, tell us a little bit about your background, and then we'll go from there, and I'll start asking some more pointed questions. So let me start with Nicole, since you're right next to me on Zoom. So go ahead, and Nicole, and introduce yourself.
No problem. So good morning, everyone. First, I want to thank all of you for taking time to come to this webinar today. My name is Nicole Augustine. I have been in the field of public health and prevention for a while. I actually first started in college under the umbrella of sexual health. Then I switched to substance prevention and actually started doing harm reduction motivational interviewing with college students. So that's where I began. And my career over the last several years have gone from prevention education to now I sit more of in a strategic planning space, really helping and assisting communities, states, in the space of diversity, equity, inclusion, and resilience. It's a lot of fun what I get to do now. And I appreciate having had the experience of starting from the bottom, if you will, from like the ground and the boots. And so I don't want to say bottom as if it's a bad thing, but having the experience of being in the community doing prevention education. So I love this work. I'm so excited about this conversation today because I do think there's a lot of great work that prevention can do specifically for communities of color because of our disparity issues and social justice issues. I think they come hand in hand together. So I'm excited to be a part of this panel and have a great discussion today. So thank you.
Wonderful. Thank you. Thank you. Mary, would you like to introduce yourself?
Sorry, I was muted. Hi, everyone, and good morning. My name is Mary Leno. I am currently the preventions coordinator for Wyndham Pride, the Wyndham Pride Coalition in Willimantic, Wyndham. My background is somewhat similar to Nicole's in the sense that I started working with nonprofits when I was in a university in my second year. And it actually came, it wasn't something I set out to do. It felt like I inevitably got dragged into it. And it's been my passion ever since. But my focus a lot is on youth and youth engagement, youth empowerment, empowering teenage mothers, HIV/AIDS education, legal support for the LGBTQ community. I grew up in an environment which is, the literacy level is pretty low. So for me to have gotten this far, it's by itself a miracle, because I did have parents who believe in the power of education and supported us in every way possible. I'm glad to be here. I hope that we have a very interesting conversation in various ways that we can, especially for Black communities as well. So thank you, everyone. I'm excited to be here.
We are excited too. And last but not least, Tyshonda, Would you introduce yourself, please?
Sure. Good morning, everyone. My name is Tyshonda Wiley, and I am the prevention coordinator of the City of New Britain's local prevention council. In my role, I oversee the Drug Free Communities Grant, which is a catalyst to mobilize community partners in finding strategies to address underage drinking and drug use. I've been in the prevention field like Nicole and Miri for about 10 years, working in youth engagement, youth empowerment, health education, and promotion. I have background experience working in not only in New Britain, but also in Windsor Locks and in the city of Hartford. So going from much smaller communities to larger and more diverse communities. I'm happy to be here today to share my experiences and to hear the experiences of my sisters in prevention, so to speak. Thank you.
Wonderful, wonderful. I love that, Sisters in Prevention. Love that, love that. Okay, so we're gonna get started. So, and when I ask these questions, you could, it doesn't have to be formal. Anyone can jump in and just start talking. Or if you rather me just call on you, that's fine too. Whatever works for everybody. So the first question is, what do each of you think are the biggest challenges to addressing substance use prevention in the Black community?
Wow, start big, huh?
I know it's a big question.
Oh man, I love it though. So I'll jump in here first and just say my background is in sociology. So I'm always kind of looking at a situation from a social perspective. And so for me, I think the biggest issue has to do with trauma as a community of people. And so I look at it twofold. I think of things like historical trauma, just if you are African-American and, are from here and our history of trauma in this country and what that does, that's a part of my belief system. I don't think we've really healed from that. I think there's a lot of residual stuff in how we relate to each other. Because for me, I see substance use and misuse connected to coping strategies for trauma. So there's a part of me that thinks some of the issues have to deal with the fact that we've got some stuff in our DNA, stuff in our baggage, in the history that we've got to deal with. So there's that part. But then there's a part of me that also sees the bigger social issue, which is connected to that also. Because when you look at a lot of communities of color, what folks have access to in terms of quality of education, schools, healthcare, environments, when you really start looking at some of our communities that are overrun by tobacco advertisements, alcohol advertisements, that you don't see in communities that have a higher SES. Right. So for me, when I think about the issues of substance use in Black communities, it's very complex to me. And for me, I'm thinking it requires some environmental strategies. It requires us thinking differently about how we got here. Because what I feel like I see more is folks using, one, because of a culture of use, but two, as a way of dealing with trauma that folks may be experiencing. So those are just some of my thoughts and where I come from when I think about the big issue here and why substance use looks the way it looks amongst a lot of our Black youth and the young Black experience in comparison to someone who may be from a place of privilege and is using just for fun or boredom. I think those things are a little bit different for some of our Black communities and Black youth in general. So that's just my thoughts.
No, those are excellent thoughts, and I want to comment on them. Mary, I see you're unmuted. So
no, it's okay. You can go ahead.
Oh, okay, I wasn't sure if you wanted to jump in. No, I think as you mentioned, as a sociologist, I believe you said, right? You did sociology. Yeah. I have a background in social work. Okay. So I understand. And I think a lot of us in here, probably in the audience, probably have some type of background in psychology or social work or public health. But I think what makes us different is that you're able to look at social problems through this historical lens, right? So looking at it like we're not just using because we just want to use. There's a history behind that. There's a history that, with generational trauma that impacts the Black community that isn't really being addressed or even talked about or even acknowledged, right? And one of the things that I talk about, it's funny, I brought this up actually last night in my class, is that if you don't name a problem, you can't solve that problem. So if no one knows what the problem is called, we're just going to be making up things to, and making up prevention interventions that aren't going to work, because we're not really getting to the root cause of the issue. So I just love that you brought that up, as what's challenging, in the Black community.
Yeah. And I'll just say, you had me think I think back to the days when I was doing prevention education, where I was going into schools and I could see the difference. It was just glaring. I'd go into some neighborhoods where it was predominantly Black or predominantly Latino, and the environment was so different from some of the wealthier schools I would go to, right? And I'd be there thinking, I'm here to to do my too good for drugs, my, PT&D curriculum, right? All, guiding good choices, all of these curriculums. And I'd be in the room thinking, is this really helping? I'm talking to a group of students about their resistance skills. We're role playing. And I'm not saying this to say that I love evidence-based curriculums. That's not what I'm saying here. But for me, it just felt like this doesn't feel like enough. Going into a school and teaching a curriculum once a week for 8 weeks and then leaving, and magically they're supposed to be different.
Absolutely. I'm so happy you brought that up, because this is the foundation of the work that I do. And after I'm done talking, I'll let the other panelists talk. I don't want everyone to think that I'm just taking over the conversation, but it's important to talk about our curriculums working for specific groups, right? And this is one of the things that I do in my work, is to highlight the fact that a one-size-fits-all approach is not going to work. There's different risk factors and protective factors that impact youth, especially substance use. And going into a school and delivering a curriculum without taking into consideration the environment that they're living in on a day-to-day basis, where they're exposed to drugs, where they're dealing with trauma, and nobody's helping them figure out how to cope with that trauma, or even teaching them what are some healthy coping mechanisms that I as a child, or I as a teenager, or even a young adult can even engage in. The curriculums by itself aren't going to do much, if anything, So I think that it's important for us to have this conversation, because it does lay the foundation, especially for those of us who have actually done facilitation of interventions in the school. I've done the same thing, and it was from the work that I've done in communities of color as a facilitator for evidence-based interventions. And I felt too, am I doing enough? I know as a social worker, I need to be doing more, but I don't know what, there needs to be more that needs to be done to address this issue. So thank you for sharing that. And I'm curious to know if anyone has any, Mary or Tyshonda, I want to give you both an opportunity to respond to the question. Not to call you.
I believe it's a combination of cultural factors at play that other communities don't necessarily face in the same fashion as we do in our Black community. In the Black community, I'm pretty sure that most of us, if you were Black and you were raised in a religious household, there was a huge emphasis placed on spirituality and religion being the end all be all to everything, right? So we were raised with religion to be our source of coping mechanism, right? So if someone is battling addiction, or someone's facing alcoholism or mental health issues, the solution was to go to church, have hands laid on you, see the pastor, pray about it, and so forth. I am a believer in God. I do believe that there is a space for faith in prevention, but also, just as important, there's also a space for prevention professionals like ourselves. There's a space for treatment facilities. So I think that that's something that we should, I don't know how that is, but to change that perception. Also, another cultural factor that I believe that's we face in the Black community that other communities don't necessarily face the same is secrets. In the Black community, we have the propensity to keep family secrets. There's a saying that I grew up with was, what happens in this house stays in this house, right? Truth is that no one learns anything by keeping secrets, or by pretending to live this picture perfect life. As cliche as it sounds, knowledge really is power, and we can learn and heal from hearing about other people's experiences. Just something personally that I want to share today was that in preparing for this panel, I had a conversation with my father. I told him, I'm getting ready to do a panel discussion on the Black community and substance abuse. And I want to tie in how in the Black community, we talk about, we don't share secrets. We know things are going on, but we don't talk about it. So just to add, growing up, my father wasn't as involved in my life. There were periods of time where he would be really involved, and then other periods of time where we would have this he would just disappearing acts. I had an idea what was going on, but it was never addressed. No one talked about it. Fast forward to about a month ago, I'm sitting having dinner with him and sharing with him about the panel. And he said that, unbeknownst to me, that during those disappearing acts, he was battling alcohol and crack cocaine addiction. So this was very powerful, very cutting to hear. But we had a very healthy discussion, really healing discussion, because I was able to just resolve some of those I didn't forgive him. But in having that conversation, I was able to forgive him and get rid of that resentment that I had for him for so many years. So again, I think it's important for Blacks to remove that stigma of keeping secrets and be open and discuss about what's really happening with us.
First off, thank you for sharing that really intimate and vulnerable story. And I think it's not just you. I think a lot of us in here and a lot of Black people, especially, thinking about the 80s, I'm assuming your father probably did this stuff in the 80s generation, where I think a lot of, Black men were engaged in, sorry, if you're coming in, can you please mute yourself? Thank you. So I think a lot of people, it was like the drug to do. It was a lot of access and availability for that drug. And again, like I think how we're seeing marijuana is kind of how crack cocaine was back then, So I think it's not just you that or your father that experiences. A lot of Black men and women back then experienced that. So I just thank you for sharing that, because it starts to, talking about these things starts to normalize it, to realize that these are issues that are impacting our community. But I do want to add on and mention that I don't think the secrets thing is a Black thing only. I think a lot of cultures believe in this secrecy of keeping bad things or these type of things within the family. And I wonder, and this may be taking us to a whole other direction, I wonder if it just has to do with being able to not reinforce stereotypes that white supremacy has put on, on non-white people, right? So the fear of being judged by the white culture and saying, oh my goodness, our family is now that family that's addicted to drugs, or, we're now proving the system, right, by showing that we're using drugs and so forth. Because I've heard this conversation amongst Asian families. I've heard this from even Hispanic families. So I think it's something, and it's a very, very common in Black families. So I think it's something that people of color struggle with. And I would love to just dig deeper and figure out what is the root cause behind that, and is it working? As we know, it's not, keeping these secrets and stuff, but just my theory, I just think it has to do a lot with challenging racism and, and just this notion that we want to show the world that we're perfect when no family is perfect, So I thank you for bringing up those topics. And also spirituality too, I think is also very important. And one of the things that I've done in my work is try to figure out how to incorporate spirituality in prevention, and talking to leaders about how they, like church leaders, or, how they can be involved in prevention and not sweep it over the rug, but actually address this as a problem that may be happening in our community, and not blaming it on the devil. That's a whole other conversation, but whole other conversation. But these are important things, topics to have, because it is impacting us, and I think it's important to have multiple sectors in the room to be able to, deal with this. So thank you for bringing this up. And Mary, I don't know if you had anything to add.
I do actually. I just want to re-echo what Taishanda and Nicole has said, and Dr. Opara, what some of the things you've said also. And I just want to say that my experience with prevention here, it's pretty small, but I do have extended experiences from my background in Africa, Ghana. Prevention in itself, it's such a taboo. It's not something you hear a lot. It's not in the open. It's very secretive, as Tashonda said, and it's deeply embarrassing to a lot of families who have children or family relatives who are addicted or have substance disorder problems.
Yeah.
And so I think that some of the biggest challenges, and it's not unique to this environment, it's global in a sense, is that in my country, it's difficult to even access quality care. There are very limited rehab centers. And so unfortunately, a lot of the people who have these problems don't even have access to quality healthcare. They don't have it at all. It's non-existent. Whereas in this case, there might be things that you can use, but when you look at the proportion of people in Ghana who have issues with substances, it's pretty high. It's just that a lot of people don't talk about it. It's very secretive. And we blame the devil for essentially everything. And so a lot of people with these problems oftentimes they get to go to prayer camps. We do have prayer camps where the devil is casted out. The devil of addiction is casted out of you. Some people are chained. There are so many things happening with substance prevention in itself in some parts of Africa, which is horrifying. And so I think that the biggest challenges, especially from my background, is that there are non-existent health facilities to even take care of you when you have these problems. And then the second thing is a secrecy, which is, as Dr. Opara said, can't be reflected among all races and all cultures. And so it's just something I want to, just my opinion about some of the challenges that the Black community, and by extension, African Americans, every Black person sort of faces.
Absolutely.
Yeah.
Absolutely. Am I echoing? Can you all hear me? Okay. Okay. I agree with you 100%, and extending it to, because Black people in itself, we're not a monolithic group, so we all belong to different ethnicities. And I love that you brought in this global perspective, and to show, like, if we're struggling here, in America, just imagine what our brothers and sisters on the African continent that have very limited resources, that aren't even, I think we're even doing a better job of even talking about it in America than we are in like Ghana or Nigeria, as I could say, I could speak on Nigeria just as a Nigerian. We're getting a little bit better, but I think, like how Taishonda brought it up, spirituality tends to kind of like be that, I don't want to say buffer, but it tends to be this overlaying factor that's preventing us from having honest conversations without blaming each other, without blaming the devil, and making us feel like we did something to now be possessed with the spirit of drug addiction. These are really conversations that, people are having, and like you mentioned, the devil's casted out of you, and you can say the devil's casted out on you and then still go back to using drugs, because you still haven't dealt with the underlying issues and stuff. So it's definitely a great point to make. So thank you for that. And I wouldn't also discount your limited prevention experience. You are, you seem well versed in your prevention work. So, I want you to also acknowledge that and acknowledge the work that you've done up until this time. And we have a question. I think, we were going to wait until after the panel, but I can go ahead and answer. We can go ahead and answer some questions. Aina, is that how you pronounce your name?
Good morning. Yes, it is.
Good morning.
Let me take my hand down so you don't. Okay. First of all, thank you again for this 3-part series. It has been worth it and interesting to listen to. My experiences are a little different because of my background. I deal a lot in historical trauma and unaddressed historical trauma. And when we talk about the core, you're right, culturally, unaddressed historical trauma goes across the gamut. But I want to challenge the word spirituality and religiosity. Based on our religious teachings of where we talk about the devil and different spirits, the spirit of something, right? If you drink a certain type of alcohol, you drink white alcohol, it's a different kind of spirit than drinking darker alcohol. Then something different comes up. And we have watched those things play out throughout our communities and in the tradition of, right? So that I am a was a student of Dr. Joy DeGruy. And
I love her.
I love her. I love her. Let me tell you how I love her. And so when we talk about post-traumatic slave syndrome, when we talk about the ideologies of what we have either come with, inherited, try to cover up and hide, and not only not accept who we are at the root, but in this whole trying to blend to fit in to the predominant culture, plays a key role in how we kind of hunker down and suppress things that even if you wanted to, it takes a lot and it takes courage. And thank you to Shonda for sharing about your dad, because when we talk about epidemics, the crack epidemic during the 80s was an epidemic, but not an epidemic because of what population it affected. And it took out an entire, so when we look at our babies today and the generations right before that, the 90s and the early 20s, we're talking about an epidemic that was never addressed by the government, that we were left to handle on our own. And so when you when you look at that epidemic and who it affected, and you look at the opioid crisis and who it affects and how it's addressed, the money poured in, then we got to go back and say, okay, how do we address what it is we need to address, because we don't want to be victims anymore. We're tired of playing that game too. Right? And so once you understand the rules of the game, then you get to decide which part you're not going to play. And I think that's the onus that we have to take as a Black community. Which part are we not going to play? And how do we educate our children? And I think the last time I talked to you about the axiology of Black folks and how we are spiritual, relational people, and how our children can learn in that environment, and that it doesn't just go from teacher to student, it goes from teacher to student, to the student's friends, to the parents, to everybody who encircles that child. And so that's my 2 cents. I love y'all. Thank you for having this conversation.
Listen, we love you too. You should actually be on the panel. Like, we love you too. Like, you just, I mean, because I think we can't talk about drugs and how it impacted the Black community without talking about the crack epidemic that wasn't resolved, and without talking about the obvious difference with how the opioid epidemic is resolved. I mean, there are millions of dollars being flooded into suburban communities, all over the country to solve the opioid crisis. There's sympathy, right, that comes with hearing that a mother or a father was using heroin in front of their children. There's sympathy for that. But with Black people, when that occurred, what was happening? They were getting removed, from the household, right? There was no sympathy at all. And this is something that still happens today, right? So I think it's important for us to have this uncomfortable conversation, but then to also see how it's no surprise that the drug epidemics, the multiple drug epidemics are still occurring in our communities, because we're not getting that same sympathy. We're not getting those same resources, and the problem with that really is racism, like naming it what it is racism, and just how Black people are viewed by the government, and how we can collectively work together to undo that and stuff. So thank you so much for sharing that wisdom with us too, Aina. And and please, I'm open, because it's a really deep conversation. If you want to ask a question, feel free to raise your hand and I'll try to address it, as well too, or the panelists can also answer. And this is just the first question. We haven't even gotten to the rest of the questions. Okay, so I'm gonna move forward, and I'm gonna actually skip around to another question. As women, there are some intersectional challenges we face in addressing substance use prevention and treatment. Can each of you name some of these challenges and possible solutions to addressing them?
Say the question one more time for me.
No problem. As women, so there are some intersectional challenges that we face in addressing substance use prevention and treatment. And just to kind of give some background on this question, and one of the reasons why I asked this question is that when we think about some of the risk factors that cause substance use and addiction for Black women, it's very different from how, the risk factors and protective factors for Black men. Right. And oftentimes too, when we think about Black people overall and the issues that are often impacting us, society tends to have us go towards Black men while Black women are being ignored. Right. And we know, just as prevention workers, there are race and gender differences that need to be addressed in prevention and treatment, but they aren't. So I'm just curious to know, for the audience that may not know these, issues, what do you can you name some of the challenges that Black women may face? Or women in general, if you want to be more open and talk about women of color, just women in general may face in receiving treatment, but then also in prevention education. And what are some of the solutions that we could think of to address them?
Well, I'm just thinking of something that comes up for me. I think one of the challenges of that Black women experience is the narrative or image of the strong Black woman, and how that gets in the way when we do finally put down the cloak of strength and ask for help. Okay. It's how I think sometimes how we're received, on the other side, because we don't just hold that image sort of society. Right. And so I think about how that gets in the way if you are someone who's seeking treatment, for instance, from that particular perspective. And what do we do about this narrative of the Black woman? And it's interesting because as much as I take honor in being a strong Black woman, I realize the imagery is problematic too, because it makes me immune to life, right? Excuse me.
Sorry, you okay?
Sorry, guys, I got choked up.
No, it's okay. It's okay. Take your time. Take your time.
And it's like it makes you immune to being emotional, to being human, to being a person. This strength that's expected, as much as I honor it because I know I have it and I hold it and I see it, like almost every Black woman I ever meet. At the same time, I think it sets us up. It creates a risk factor. You know what I mean? And so I think about that part too, where you can suffer in silence in order to hold up the imagery of strength. And that's what comes to mind to me from the personal perspective. And then I think about when we get into a situation where we do ask for help, because other folks look at us as strong too, when we complain about pain, when we complain about what's happening in our life, it's minimized or it's not taken as seriously. And so I think about how that factors and plays a role, excuse me, in health outcomes. Sorry, I don't know what's happening, so I'm gonna press mute and let someone else talk.
Get some water, take it easy. And I love that you brought up the strong Black woman label, right? Because because that in itself deals with a lot of things that impact Black women. Yes, Black women, we're strong, we're resilient, It's because we have to be. It's because the world has made it so that they don't want to feel sorry for us when we're going through, going through specific issues that may occur for other women, but other women are able to get the sympathy, they're able to get the help, and we're looked at as people that you should just be able to figure it out or deal with it, or it's your fault that you're going through this, so you have to just figure it out, and that in itself is very problematic. It's very stressful, and that in itself can contribute to not only engaging in substances to cope, but then also realizing that you can't even speak out when you have a problem, or seek treatment, because you're not even able to recognize that you have a problem, or you're not comfortable to even talk about the fact that you may have this this issue, and nobody, or even being scared to even come out and say I have this issue, and worry that you're not going to be demonized for it or criminalized for it. I remember when the marijuana legalization was on the rise. It's still, it's a controversial topic. I remember it was on some national, I think it was Today New York, I can't remember what it was. And there were these two white women who were talking about how they use marijuana when they're pregnant. And it's so like, they were basically talking about how it's so therapeutic and all of these things. And I was just thinking, wow, Black women can never do that. Like a white mother can actually come out on national television and talk about how not only she uses drugs, but she uses drugs when she's pregnant, and it's actually being celebrated for that. Like a Black woman, there are Black women who have lost their children, because of these things, because of even lesser things than that, so that in itself is just an example that people don't even, this is why I talk about naming a problem, these intersectional issues that impact Black women uniquely. We're not able to move through the world freely, like how our white counterparts may, so I'm really happy that you brought that up. Anyone else on the panel want to just jump in, Tyshonda or Mary?
Yeah, I just want to say that apart from the narrative that Nicole said, it's extremely also difficult to even assess a lot of, for instance, it's not just for prevention, actually. Black women have historically, there are so many places where you cannot even access basic, I'm trying to reframe my thoughts, but what I wanted to say was that it's not only in prevention. It's not, you cannot find that narrative of the strong Black woman in prevention. It's in childbirth. It's in a lot of the medical things that Black women access. And I think the second thing, the biggest challenge is that there isn't a lot of research that has been done on especially the Black community in terms of prevention related to Black women historically over the years. I think that having these conversations, there's a lot of awakening on the issues with prevention related to Black women, and not just only prevention, but other medical problems as well related to Black women that Black women experience a lot more than their other race counterparts. And so I just want to say that it's not only in prevention, it cuts across a lot of medical fields. The third thing I also want to emphasize is that I did have a friend who had severe problems with trauma. And a lot of the places that she could access care, a lot of the psychologists or psychotherapists were mostly white women. And I think that if we were to ask a lot of my panelists here, would you be comfortable talking to a white psychologist or a psychotherapist? Or would you be comfortable talking to a Black psychologist or a psychotherapist? And these are a lot of the things that echoes when you talk to a lot of Black women. Would you be comfortable talking about these very deep, very painful, very difficult issues with people that are not of the same race with you? And it cuts across a lot of it's intersectional, because it's not only unique to prevention or substance misuse. It cuts across so many various medical things experienced by Black women.
To piggyback off of Mary, there echoes up. Can you hear me now? Okay, good. Just to piggyback off of Mary, I believe that another issue is that we don't have enough culturally relevant resources that identify as Black and female. At the start of this call, we were all talking about how it's nice to see the majority to be us, right? When usually when we walk into a room, we're the minority. So I think it's important to, the solution to that would be continuing to have conversations and panel discussions like this, where you see Black women in prevention leadership roles, where we are expressing our cultural identity. It's very important to have our voices heard, just to change, make that impact for people.
Absolutely, and that is such a great point. And I just want to just give a shout out to Carol Meredith. She is in the audience. She's the Director of Prevention and Health Promotion from the Department of Mental Health and Addiction Services. She's a Black woman, and this role is very important, for her to have in the state of Connecticut. And I'm just curious. I don't know if Carol is there. I don't mean to put you on the spot. But I just want to honor you for your work that you're doing in the state of Connecticut. And if you wanted to just jump in and add a couple of thoughts to our discussion, if you don't, it's okay. But just wanted to just honor you and just let the audience know that you're here. Is she there? Okay, it's all right if she's not just not there. But just wanted to just shout her out. Okay. But thank you so much for bringing that up, Tyshonda, because I think it is important to when we're talking about developing solutions for Black women, to have Black women on in the room, to have Black women in these roles where we could actually have these conversations to talk about the specific issues that are impacting us and ways to solve it that are culturally specific and race and gender specific. I mean, this is the next step to the problem, and this actually leads to my next question, which is, as professionals, what do you think that we can do to reduce substance use and abuse overall? And this is kind of open, not even just for women, but for children. What do you think is missing that we can all come together and contribute to reducing it?
Well, from my perspective, because I believe it's going to take a pretty big social movement for that to happen. I think one, we've got to break out of some of the silos. Our governmental system has done a great job of siloing the money. The right hand doesn't talk to the left hand. And I think about the social determinants of health and how we really should be creating an entirely new ecosystem with communities, as far as I'm concerned. Because like the example I gave earlier, going into a school, and I think about what prevention does, because that's where I come from. A lot of folks in prevention are taking quite a bit of money and they're just doing prevention education. Yeah. So this is why I'm a huge fan of the coalition model. Yeah. Tyshonda mentioned DFC, drug-free communities. I love these models that look at more of a coalition and environmental strategies where you're doing more than just the prevention education strategy. You're actually partnering with the right communities to look at what is the economic development of the community? Yeah. What is the access to health resources? What's the access to educational resources? Yeah. Right? What about the built and social environment? So to me, it would require us doing something different and being way more innovative about how we, yes, that village mentality, right? Around how we do our work. I think it starts with conversations like this. It starts with our leaders. And I've been thinking lately about how, are our folks who are the gatekeepers and the hinges to the gate too, okay? Are these folks even knowledgeable of what's happening on the ground level? Yeah. Are they so far removed that they don't even know? And I just wonder, how do we begin to bridge the gaps between the folks who have political power to say where money goes, for communities that typically don't have I would say, human and intellectual capacity. Let's just be real, because if you've ever seen a grant application, I mean, these federal grant applications, you almost got to have a degree just to read the requirements to fill it out. So when you're talking about a community who would love $125,000 for 5 years, unless they find the right person to partner with to help them fill out the application, one, they don't even know the application exists. So to me, I just feel like there's these huge gaps between funding, and there are billions of dollars in the funding space, okay? And communities actually getting them and getting access to it to develop jobs, to improve healthcare, to improve the educational system, to get rid of a lot of these predatory industries right in these communities of color, where and for me, I always tell people, if you really want to see, just get in your car and take a drive and stop at different convenience stores in different neighborhoods and just go to the alcohol section, go to the tobacco section, go to, if there even are fruits and vegetables, and just look and see the difference between the convenience store in one neighborhood and the convenience store in another neighborhood. And to me, that's all you need to see that there's differences. And until we start doing that and seeing some of these, the policy changes we could be making and support, because a lot of communities I feel are overrun because the industry can do it. There's nobody pushing back saying, we don't want that in our neighborhood. We don't want that here, you know?
It's normalized, right?
It's normalized.
Where it's like expected for
Yeah.
us to have this. Thank you so much. Robin, I see you have your hand up. Did you? Oh, Robin, you're like really important. So I want to shout you out. I recently just found out that you're recently retired from the department. So I want to just honor you and thank you even for being, for participating and being in a part of our discussion. You're one of the few Black female prevention specialists in Connecticut. So thank you for your work.
Thank you so much. And when I saw this webinar or program being promoted, I was just like, wow, I got to see this. So even though actually I don't even live in Connecticut anymore, I'm excited. I'm excited to see all these women here together and talking about a subject that is so very important to us. There was one thing I wanted to address that I really appreciated Nicole bringing up as far as coalition work. It is very important that we get the minority communities infused in working with and collaborating with the coalitions. And myself, here today, I would be representing the faith-based because I'm one of Jehovah's Witnesses, and I've always brought that mentality into my work. And I was with the prevention unit there at Demas for the better part of, I think, 20 years. What I think is extremely important is that as minority women, we need to reach out to our colleagues in the different communities and towns across the state of Connecticut to let them know prevention works and to get involved. And Nicole brought out a serious point when she said, looking at these RF requests for proposals from be it state level or federal level, they are involved. They can be intricate. And how do you even wrap your head around what you need to know? And so we need to educate our base. And one of the things and one of the resources that are out there is like, prevention TTAS, they have all these trainings and so forth to educate the base, because to become a prevention professional, a certified prevention professional, it takes, you have to get involved and go to these trainings and be educated so that you can make that test. And when I took the test, I tell you, I stress and all kind of stuff was happening, but you can do it, you can pass it. I feel like if I can do it, anybody can do it. So it's possible, but in order to be able to understand how to address grants and all like that, they have all of that education, grant writing, and collaborating with the folks in the community, because you don't have to know how to do everything. You just have to find somebody that knows how to do it. And that's where that coalition comes together. And you can work with different folks in the coalition, but reach out to those minorities in the coalition, in the community, so that they got a voice. Because what happens is that you find that, you may be in a large city or whatever, but the people that need to have a voice are not in the coalition. So it really takes some boots on the ground work. I've seen it being done with, I worked with Taishanda and some of the other women here, and I'm so impressed about what I see going on right now. And so I just want to encourage you all, reach out to the folks in the community that can be on the coalition, and also reach out to other. When I saw the state, when I worked with the state under Carol Meredith, excellent preventionist in the state of Connecticut, when I worked under her, the umbrella of prevention, we were often reaching out and trying to find underserved communities that were not being represented in the grants that we were putting out there. And time and time again, we just weren't getting applications from those communities. And I believe it's because the knowledge, the people that need to be reached haven't been reached. The networking hasn't reached that far, and that's what I'm encouraging folks to do. Network, find those those communities that you usually don't see at the table. Reach out to that person, and they may be in the health department or in a prevention unit, and they may be only focusing on AIDS prevention. They may be only focused on a small aspect, and they don't realize that they could widen out and get such a bigger bang for the buck if they grab for those dollars. And I'm just like, grab for the dollars, because they're there. Okay.
Thank you so much. Thank you so much for that, Robin. And we're grateful to even have you in the audience. And I think to also add to that in regards to grants, it's also important to collaborate with universities. And I don't know the climate of Connecticut, because I just moved here in July. So I don't know how much universities support a lot of all of us here that do prevention work have received. I'm not even sure of the trust that is, especially with like universities like Yale or University of Connecticut. I don't know what that environment is like, but I will say that universities, professors and researchers, this is all they do is write grants. So being able to partner with people that have a passion for this, for this work, and that could support a nonprofit or a coalition to provide some grants, writing assistance. One of the, my lab, that's all we do is write grants too. So that's so I'm throwing myself in there if there's any support that I could offer in writing a grant or, letter of support or whatever it is too. I'm, me and my lab and my team are always available as well. So thank you. So thank you so much for including that. Shayana, Shay, sorry.
Listen, I'm Shayana too.
Oh, okay.
One of the things that I was going to touch on with what Nicole was talking about with zoning, I am originally from Detroit. One of the main things about Detroit is everybody knows that there's 8 Mile Road, whole movie about it and everything. The thing with 8 Mile is that it's not just a road, it's essentially a red line. And it separates Detroit, which is 88% Black city, from all of the other northern cities, which are majority white cities. On one side of Detroit, like on 8 Mile Road, all you will see on 8 Mile Road are liquor stores, convenience stores, strip clubs, small casinos, that kind of thing. I remember one time like driving and I asked my mom, like, why are on this side you see factories and stuff on that side of 8 Mile, but on this side you see strip clubs, and now you see medical marijuana stations on this side too, but you never see that on the other side of 8 Mile. Never see that on, like, you only see it on our side of 8 Mile. And a lot of times, like my mom, she isn't like, necessarily the most PC person. And she's just like, well, that's what Black folks want. It's on that side because that's what Black folks want. And I'm like, it's not, I don't think Black people necessarily want it because we're not the ones that own it.
Right.
Like it might be there, but we're not the one that owns it on that side.
Right.
Because when I see like sometimes my brother and stuff go over there, it's usually other groups that own it. And that's usually the only times that I ever see other, like large amounts of other groups in that side. You don't see large amounts of white and Asian groups in Detroit unless they own businesses there.
Right.
But you see them living on the other side of Detroit. And for us, it's just like, why is it that you can open all of these businesses in Detroit, but you can't live in Detroit? You don't want to live in Detroit with us, but you want to open all of these strip clubs in Detroit. You want to open all these marijuana dispensaries in Detroit. You want to open liquor stores. But on the other side of Detroit, on the other side of 8 Mile, you have Whole Food stores. You have fresh produce stores on the other side of Detroit, things that are, good for your body. But on our side, it's just, infrastructure isn't there. So that's just one of the things that I just kind of like in my, I still go back and forth to Detroit quite a bit, but it's just one of the things that I like always think about when I'm there is that this could be so like, we don't have that infrastructure there where our communities are thriving because we have that kind of things on our side of the, on our side of the city, and those kinds of things that promote substance use in our communities already.
Thank you so much for adding that. And I don't even think you have to even go as far as to Michigan, right? Like we're seeing it within urban.
It happens here.
It happens in Connecticut. It happens in New Jersey. It's actually one of the things that I'm working on in Patterson, the community that I do a lot of work in, is to figure out how to create more zoning protections so that liquor stores, marijuana dispensaries, and tobacco advertisements are not being in close proximity to schools, parks, and where youth play at, because it's all done by design to encourage this cycle of addiction, to create access. They want youth to be addicted to these substances because that's how they're able long term to guarantee that youth are going to use this until they become adults. And that's a much larger population, a much longer time that they could that can invest money into more purchasing different substances. So it's really done by design, and it's like, I could have a whole discussion on just that, right? So
Yeah.
before we wrap up, I just wanted to give all the panelists an opportunity. We didn't even get through all the questions, but I knew that was going to happen. But I just wanted to give all the panelists an opportunity to just end the panel with, a word of wisdom. What do you want the guest of the audience to get out of moving forward, the work that you're doing, or just any type of words of wisdom related to prevention, education, and treatment? And let me start with Tyshonda.
Okay. Well, for today, I just want to say I truly enjoyed the conversation. I learned so much. Ending comments for me is that, as I said earlier, I think it's really important to see conversations like this to continue happening, to see Black women, so women for one, and Black women being well represented in these prevention leadership roles. I was going to add, but we didn't get to the question, but one way that we can address prevention is starting at an earlier age. And by starting at an earlier age, we're therefore preventing youth, as you all know, preventing youth from hazardous conditions, the brain is still developing until age 25 and so forth. But if we start at an earlier age where youth are seeing Black women like ourselves that they can identify with, then they'll say, you know what, that's someone that understands my lingo, my style, where I come from. And so therefore I'm more now empowered to do what they're saying, to lead that positive life that they're encouraging me to lead. So again, thank you all. I truly enjoyed the conversation today.
Love that, love that. Mary, do you have any ending comments you want to share with the audience?
I do, absolutely. I just want to say that I really enjoyed myself here. I wish we had a much more longer time. I do hope that T-Task in the future will do a lot of these series so that a lot of people will join and participate in it. I just want to say that, and I want to say this briefly, that just working on the DEMOS grant, I know that there's a lot of thought behind that, the grant is difficult and all that, but I just want to say a big ups to DEMOS for putting together this grant. It is one of the most easiest grants I've worked on, especially for underage drinking. I love the strategic plan, the way that it's set out. It's very basic, very interesting. And I love the fact that a lot of it echoes community engagement. empowering the coalition, networking. And that's been really great for me as a professional in doing this thing, is that I do love the work that Karen, who's my boss and she's here, that she's done a lot of work into building the coalition and building community engagement and getting a lot of young people, the youth council that we have. And so for me, I just want to say that, as Tashonda said, it's important to have a lot of us in the field, that a lot of young people, especially Black girls, will look at us and see some of the work we're doing and know that it can take some really good parts. And I always say, and it's going to be like a signature quote, that an investment in a young person is not an investment in vain. You could tell the direction of a community in the investment it makes in its young people. And so I just want to say that it is incumbent on us as Black women who are in this field to make sure that a lot of our generations who are coming will benefit from the work that we are putting in. And so it's not an investment in vain. It's not a work in vain. It's a very essential thing that we're doing. And I just wanna, just raise my hands to all the women who are here and supporting us and just believing in us and what we do. So thank you, Dimas, and thank you, Titas and Shayana, for putting all of this together.
Thank you for that. And last but not least, Nicole.
Only thing I'll say is I want to encourage everyone to continue to be brave in this work and courageous in this work, and to also remember your own self-care, because every time we do this work, it brings up stuff. And so that's my only place of encouragement to you all. Continue to be brave and courageous, but remember your own self-care in this work. And so I'm just happy that we had this conversation. This has been awesome. Thank you for having me as a part of the panelists.
Yes. Thank you so much. Oh, I'm so excited about this conversation. There's so much work that needs to be done, but we can do this work together, right? So that it's not all on our shoulders, but bringing in people like us in the room, bringing in our allies, right? So even bringing in non-Black women who can, who support us in this fight and are able to, utilize all our resources to be able to accomplish the overall goal. Thank you all for joining us. I wish we could have more time to have this conversation, but hopefully in the future, we'll get, more support to do this work throughout the year and stuff, because we just can't have one conversation. We have to continue having many conversations. So thank you all. Have a great rest of your day. Please feel free to reach out to me or any of the panelists if you have any more questions or thoughts or want to, work with us. Bye, everyone.
Bye.
Thank you, Aina.
Thank you.
Aina, you're a blessing. Thank you.
Thank you, Dr. Opara. And thank you, Shay, for inviting me to this, and Dr. Opara for facilitating the conversation. I truly enjoyed it.
Awesome.
We need to do this more often.